Welcome back to the Real Estate Girls podcast. We're your hosts, Heather and Kaci. Whether you're buying, selling, or just obsessed with the market, we're here to bring you expert advice, behind the scenes stories, and a dose of realness.
We got a fun and an insightful episode lined up for you today. Today's topic will be focused on the growing demands placed on women in the workplace. Many women are balancing careers, family responsibilities, personal expectations, and professional growth.
We will touch on the importance of sustainability and high-performing careers, and why intentional rest and self-care are not luxuries. They are strategic investments. But first, we're so excited to introduce our next guest, who helps women feel confident, refreshed, and ready to show up for their best.
Joining us is Nicole Johnson, founder of Illume Med Spa, right here in Panama City. Originally from Georgia, she's been calling this area home for the past 7 years and has built an incredible reputation in the aesthetic space. Nicole brings over 13 years of combined medical aesthetic experience to the table. She actually got her start working as a dermatology medical assistant, which sparked her passion for aesthetics. Since then, she's trained alongside some of the top injectors in the country and has developed advanced skills in fillers, Botox, PRF, and regenerative skin treatments. Nicole works with many professional women who are balancing demanding schedules and still want to invest in themselves. What really sets Nicole apart is her approach. She's all about enhancing natural beauty, not changing it. She focuses on restoring volume, improving skin health, and helping her clients feel confident with results that truly look like you. When she's not at Illume, she's spending time with her husband and her young daughter, staying active, traveling, and cheering on her Georgia Bulldogs for the college football fans out there. Nicole, we are so excited to have you on the show today.
Thank you. I'm excited to be here.
Awesome.
Yeah, thanks for coming. So, Nicole, can you walk us through your educational background and training, and what ultimately inspired you to open up Illume Med Spa?
Absolutely. So it first started off when I was working in dermatology as a medical assistant. I would assist in surgeries, but as well as like aesthetic treatments. And it was always such a positive atmosphere. And I said, this is where I need to be. At that point, I had my bachelor's in biology, had planned on going into some sort of healthcare schooling, PA, nurse practitioner, MD, wasn't quite sure. Eventually landed on nurse practitioner. In the state of Florida, you do have to be at least a PA or a nurse practitioner in order to inject. And so I started back to school, and while I was in nursing school, I flew out to Arizona and Georgia, states that you can actually inject in, and I went ahead and started practicing there while I was continuing my education, getting my master's here. So after I graduated from nurse practitioner school, just continued my education for a couple of years, and also had a baby, and yeah, that's kind of where I landed.
Where did you go to school to get your bachelor's?
University of Georgia.
University of Georgia. Okay, go Bulldogs.
Go Bulldogs, that's right.
I actually started as a pre-med, like biology, like major as well. Organic chemistry killed me.
Yes, it's
So
not easy.
how did you get through that? Because I was like, no way.
Yeah.
And I changed majors.
I mean, it was very hard.
Yeah.
But just getting together with classmates, studying
Yeah.
after hours, on weekends, things like that, learning different tips and tricks from other people. I mean, that's kind of the name of the game with any schooling. It's all really
Absolutely.
difficult. And so you just kind of learn how other people learn, and you just kind of bear through it.
And I think there's a stigmatism out there like, oh, anybody can do what you're doing. And that's not true.
Yeah.
And so for those who don't know what a medical spa is, what exactly is a medical spa? And for people that want to try it, what advice would you give them?
There's a lot that can go into a medical spa. It can be, just simple aesthetics as far as like massages and facials. It can also include injectables. Me personally, I'm just like a solo injector with just one single room. So I just do the basic injectables, Botox filler, chemical peels, PRF, that sort of thing. Anybody who is like interested in treatments and things like that, you just go online and do some research. And I mean, social media is everything. And so going and looking up like what different services different med spas offer is definitely the key.
Awesome. Yeah, I know we have a mutual friend, and I remember before we were introduced, he was telling me about all this training that you had, and I was like so impressed. All the different places you've been, and you've trained us alongside some of the top injectors. And I feel like someone like me that's never been to a med spa or might be interested in it, it gives me comfort knowing you've had vast training, you're a nurse practitioner, you're well qualified.
Yeah.
What are some of the biggest misconceptions people have about med spas, and what's the truth behind them?
I think the biggest misconception might be that women are going to come in, get a treatment done, whether it's Botox, fillers, whatever, and they're going to look overdone and not themselves.
Yeah.
When that's definitely not the case. It takes a lot in order to kind of look a different way. And so, a natural approach is definitely the way that I go. So yeah, it's hard to kind of look unnatural, as crazy as that may sound.
Yeah. I know I've been to you for Botox. I remember I got in the car and my son's like, "Mom, you look really good."
Oh,
And I was like, "Thank you."
love to hear that, because kids will keep you humble.
Yeah, they will. They're so honest. They're the most honest.
Yeah, especially teenage boys.
Yeah.
To their mom,
Absolutely.
you're like their best friend, and they'll tell you anything that's wrong with you.
So what about, you hear all the time, results are permanent. Are results permanent?
No,
Okay.
no.
So that's a
We're
misconception.
constantly aging. And so
Right.
even if you went to a plastic surgeon and you got a facelift, that result is not permanent. On average, like if, say, a woman gets like a facelift in her 40s or 50s, she likely will need another one. So we're constantly aging. Botox goes away after 3 to 4 months on average. Filler, we're learning that filler can last a little bit longer than we originally suspected. It's different for everybody. Our bodies process everything a little bit differently. But no, nothing is forever.
So you hear people, when you're pregnant, you can't get Botox. That's because your body's processing that Botox. What's the reason?
So there's just no studies done, and there probably never will be. It's just not worth the risk to see if that neurotoxin does cross that blood-brain barrier, and is able to seep into the placenta and get carried on to the baby. So this just one of those things where it's not worth the study. And so therefore most injectors, if not all, should say no to injecting anything while someone is pregnant.
Have you ever turned somebody away that maybe doesn't align with kind of what you want to accomplish? Or, say you have somebody that maybe looks more on the more, quote, fake, unquote, spectrum, or it's overdone. Do you ever say no to those type of people? Or
Yes, and it's important to, because looking just natural, but also just a little bit softer is my approach. And so in order to maintain that, I have to turn down some people. And there are other injectors who would be happy to inject them because they just have like a different style.
Right.
This is really like an art form. And so it's like a hairstylist. Every hairstylist does hair different. Every artist does art differently. And so there are injectors for everyone, but yes, I've had to turn people down.
Right. And like the misconception that, you can go to different med spas and you'll get the same result. That's completely false, because
Completely false. Every injector has such a different technique, and techniques are also changing. So no, you'll always get a different result with any injector.
What are the popular services among working professionals?
Botox is the most popular, along with fillers. Microneedling is very common, chemical peels, anything that is just going to give women like a refresh, pretty much.
What's the difference between Botox and fillers?
So
I just don't know.
that's actually a very common question.
good.
So Botox, we say that it relaxes muscle. It targets muscle movement. And so there are like common areas in like the upper face, the 11s here, the forehead, and the crow's feet. And it just helps to relax that muscle, prevent it from moving, which prevents lines and wrinkles. There are other reasons for getting Botox, but filler actually, it fills. And so the old school way of doing filler was to go and fill in lines when that's really not the way that we inject anymore. We're more so filling in areas of volume that we lose with aging. But yeah, that's the
Okay.
main difference.
That makes sense.
And filler is like a hyaluronic acid. So something that we naturally produce in our body. It's just a sterile form that's lab derived. So yeah, that's the difference.
Do you try these products yourself?
Yeah.
Really?
Yeah.
What's your favorite?
I mean, I love Botox, but I won't do filler on myself. It's a little too dangerous. But yeah, anything that I can safely inject myself or do myself, I'll do in the office. It's actually time for my Botox right now.
So you are on social media. I love some of the social media reels and the content that you're putting out. I think it's very informative. It's engaging. It's entertaining.
Yeah.
Some of them, I'm like, if I'm having a bad day, I'll see it and I'll laugh.
Yeah.
You know. And so, did you think when you opened up this med spa at Illume that social media would go kind of play such a big role in marketing?
No, in fact, as soon as I opened, I think like I was comparing myself a lot. I mean, I'm a new business, and so I'm looking at these really successful and wonderful local injectors and what they're doing. And I was like, you know what? I think I want to step away from social media. Then I realized how important social media was. So you know, I had to just suck it up, get comfortable with the uncomfortable, and start posting silly reels, and also informative posts and things like that.
Well, I think you kind of, a lot of that is kind of the misconceptions that we've been discussing. You kind of, put, basically it's informative. Like, some people think this, and it's actually made me more comfortable. I will be seeing you. I have a gift certificate that I need to use that my husband got me. But a question I do, obviously, when I think of this, it's more geared towards women, but do you treat men as well?
Oh, yeah.
Okay. I like that.
Do you have a lot of men come in, or is it mostly women?
It's mostly women, but a lot of couples will come in together.
Yeah,
That's cool.
that is
like
cool.
instead of like
I
a
like
couples
that.
massage, it's
Yeah.
like a couples Botox session.
Yep.
I had a friend, and she told me she saw me like one of your reels that you post, and she, I guess, went to you and tried out the Botox route, and I was like, that's so cool because she does a
Aw.
great job.
That's sweet.
So I love hearing stuff like that.
Yeah.
But I think you're right. As women, we definitely or as business women, we compare ourselves, but we do have to get comfortable with the uncomfortable so we can put ourselves out there. It's important. And you definitely help a lot of women by making them feel good about themselves in that space.
Yes, that's the ultimate goal, is
Yeah.
just to make everybody feel comfortable. And honestly, like social media presence kind of, it gives off like your vibe.
Yeah.
And so when people are looking for injectors, I know I'm not for everybody as much as I would love to be. But I've had women come to me, not even for like the before and afters or informative posts, but they're like, I just think that you're so funny. And I'm like, well, thank you.
It's relatable.
Yeah.
It's
Exactly.
relatable.
Yeah.
Is what it is. And you do a good job of what you do. And do you ever see clients where maybe they were treated elsewhere and it wasn't the results that they wanted, so you had to kind of do some, correction? Do you see a lot of those, or?
I mean, not a ton.
Okay.
We have so many talented injectors in this area. And so not a lot. And I mean, even women who are moving from out of the area, have had to go in and either dissolve filler or, kind of correct some things. But yeah,
Is it mostly young professionals that you were seeing? Are you seeing people from all different spectrums, all different ages, or
all different ages.
Okay.
In fact, I feel like, I need a pop-up spot in Margaritaville because they're all.
my gosh, that's brilliant.
I
That
see
is brilliant.
a lot of clients that
Yes.
live in there,
Absolutely.
but also a lot of young professionals. So, I mean, just any and all ages from like, in their early 20s to in their 80s.
Wow.
Mm-hmm.
Wait, go ahead.
I was going to say, what age do you recommend women to go ahead and start Botox? Because I know, or correct me if I'm wrong, it prevents wrinkling later on in life.
They say get a
It can.
jump start on it.
Yeah, and so I don't know if there is an age necessarily, but I tell women who are 25 and older, the best like preventative that you can like give yourself is thickening up or continuing to thicken your skin, because whether or not we realize it, our skin is thinning over time. I like to compare it to like my toddler at home. She's got full collagen and elastin production. Collagen is what gives us thickness in our skin. Elastin gives us bounce. She has full, like, bouncy, thick skin. So it's hard for her skin to form wrinkles. And I compare that to like a piece of cardboard. Our skin is like at cardboard structure right now, or when she's young. So she's going to continue moving towards like tissue paper. And so microneedling or something that's going to boost collagen production is what I recommend for anybody over the age of 25, because we need to stimulate collagen since we stop producing it naturally at
So
that age.
what do you when you do a microneedling procedure? What does that look like? Explain that to me.
So I
Sorry,
they
I'm
are
flirting.
numbed for it, first off, so it's not super painful. A patient of mine compared it to like a cat licking their face, like the sandpapery texture.
Is it needles going in your face?
So it's small little needles going rapidly in and out of the skin, and that creates like a micro injury. You leave my office looking like you have a sunburn, so it doesn't look like you've had like a crazy, like you don't have tears all over your face or anything like that. But those micro injuries signal our body's wound healing response, which stimulates collagen production. So it's a very simple, quick procedure. I let you numb for about 15-20 minutes. Just use my little pen to microneedle, and we can use like Glide or like what it comes with in the package, or PRF, which is like our own body's growth factors, or some exosomes to help boost collagen a little bit more. And that healing process is about 24 to 48 hours on average.
And how often can you get this procedure done, the microneedling?
Every 4 to 6 weeks.
Oh, wow. Okay. And so the results, you're going to have new collagen production. Does that address wrinkles?
It can soften wrinkles, not deep lines that have been there for a very long time, but it can definitely soften wrinkles. It can brighten up your skin, help reduce pore size, just give like a nice glow to your skin.
Gotcha.
What's something behind the scenes that people would be surprised to learn about running a med spa?
It's expensive.
It's expensive.
It's very expensive, whether that be the product, the training, anything involving a medical spa is going to cost a lot. So I think that a lot of my clients have like a misconception, and that like whatever price I give them is like most of that is profit, when that's definitely not the case. But it's worth it, in my opinion. For me, the cost is worth it,
Right.
the expense.
Because you're saying these products are very expensive.
Very
essentially.
expensive.
Yeah. Interesting. I wouldn't think that, but I mean, it's very competitive, like you said.
Very.
This is very competitive. How many med spas do we have in Panama City?
I
Do you
do
know?
not know. They are popping up all over the place.
Wow,
Yeah.
really?
Yeah.
I went to one, I want to say a couple of years ago. My friend Victoria, she's like, "Hey, do you want to go? I got this deal on Botox. You want to go with me?" And I went, and it was so informative because I hadn't really looked at my face. Like, I obviously put on makeup or whatever, but she's like, "You see those wrinkles when you make an expression in the mirror?" And I was like, "Oh my gosh, this is aging.
I've said this before, but my favorite thing about getting Botox is, so I make facial expressions when people say things all the time.
I know.
My favorite thing about getting Botox is I can be in a meeting and I don't have to worry about my face at all.
Exactly.
I'm
is
cool
the number
and
one reason I
collected.
think I need to do it.
I know. I have
Yeah.
like teachers who are like, "Can you please fix my RBF?" I'm like, "No problem."
Not a problem.
I think too, just, confidence is a big thing. Like for me, if, I put on a little weight or I put on a dress and I'm like, "Oh my goodness," like that could ruin the whole night.
Yeah.
It would be like, "Honey, we're ordering in.
Yeah.
Order the pizza,"
Yeah.
But I think if you're feeling good and you feel confident, that can, overflow into your professional, your relationships and all of that. So I think that's probably one of the reasons why they're so popular is
Oh, absolutely.
they make people feel good.
Yes,
And they-
and that's always the goal. I can't tell you how many women I have come into my office in tears because they have sacrificed themselves for almost their entire life. And then they just look in the mirror and they're like, who is this stranger? And none of the women that come in to see me do it for anybody else but themselves.
I love that.
Which makes me happy. So boosting confidence is like always the ultimate goal.
Do you ever have women that come in and they have no idea what they want
Yeah.
and
See, that would
just need
Yeah.
recommendations?
That's what I mean. We need to set up an appointment because I have no idea. My face is naturally red. A lot of people don't know this, but when I take off my makeup, it is like I have a sunburn. So I don't know if that's rosacea or what. But so you do individual consultations?
Oh, absolutely.
Okay.
This is very much, I mean, just like any form of medicine, it's very much individualized. Nobody is treated the same. Even Botox treatments, nobody is treated the same. As simple as Botox is. So it's all very
that.
individualized.
It's tailored to you.
Each individual. Yeah, I do love that too.
Okay. What treatments help women feel refreshed but still natural?
I mean, Botox probably is like the number one, but if you're looking more so for like a glow, refresh, microneedling, chemical peels are probably second in line.
What's the treatment that's going to give you the minimal amount of downtime where, oh, I got to go to work tomorrow. What?
I mean,
I gotta see people.
I see women who get lasers like the day before they go to work. So
Wow.
I always tell people like, no one cares. And if they do, that's just a reflection of themselves. And so like, if you've gotten like this in-depth laser, I have women who are like, okay, how long do I need to stay in the house? And they're not talking about like staying away from the like sun exposure. They're just like staying out of the public. And I say, go out, do your grocery shopping, do your normal. I said, nobody is looking at you. I said, if they are women, they want to know what you've had done so that they can look into it. Men, they just want to know that you're okay.
Yeah.
I've had a patient of mine, she told me she had a crazy laser done the day before she had like a board meeting at work. And she was at work, her eyes were super swollen the next day. And the men are just like, she's like, I had a laser done. And they were like,
No, I did not get into
Like,
a fight.
yeah, they were just like so relieved because they were just like, okay, she's okay. Now we can focus on what we're here to do. Nobody cares. So I always tell my patients that like, it's fine. Nobody's looking at you. But for like most minimal downtime, I mean, Botox is not immediate. It does take about 2 weeks to fully kick in.
Okay.
So, but the downtime is very minimal. Bruising is always a risk, though. We're using a needle. Chemical peels, it varies a few days to 7 days of peeling, and then microneedling. I myself can do microneedling, and then the next day it doesn't look like I've had anything done. So it really differs on
Gotcha.
person to person.
Cool. Yeah, I mean, I think that's so true. Like, nobody really notices but you.
Yeah.
Like, you are the biggest critic.
Yeah.
Everybody
Right?
is so they're too focused on themselves to really worried
agree.
about what you look like. But like I said, like women, if they are looking at you, they're like, what did she have done?
Yeah,
What
tell
did
me
you have
about
done?
it.
Tell
Yeah.
me.
Tell me your ways.
Tell me.
'Cause you're
And then
fantastic.
yeah, and then men just want to know you're okay.
Yeah, I had a peel done and I went into the office like right after because I had business to do. And Tom, our broker, he was like looking at, like you could tell he didn't know what question to ask.
Yeah.
But he's like, what is wrong with you? And a new agent that we had in the office, she was like, oh yeah, I've been wanting to do that.
Exactly. I know. Like it's gaining popularity, and I'm so glad because like I'm sure 15, 20 years ago is a very different discussion. Everybody hid their treatments. No one wants you to know that they've had anything done.
It was
but
like taboo to
people
talk about.
are becoming much more transparent about it.
Yeah.
Thank goodness, because yeah, there's no sense in like staying away from population for 7 days or whatever the downtime is.
Absolutely. Yeah, I think it was kind of looked down upon, right? If you got something done. I mean, and now you have women, they're like, yeah, I got something done.
Yeah, I mean,
living
people,
the best
women,
life.
women
Yeah.
will go and they will record posts every day about their healing journey. I love that. That is so helpful to help women gain perspective. Like, okay, if I get this treatment done, this is what I can expect. Not that everybody is their journey is gonna be the exact same, but it just gives you some insight.
And I think too, like I mean, we didn't have iPhones in high school. I know we're older than you, but
Just a couple
teeny
years.
tiny bit.
Heather's like, over
Okay,
here.
all right. Here's my grades. But like we didn't have iPhones, we didn't have social media. It's crazy, you know. If I see a picture that I hate, I'm like, nah, we're not posting that.
Yeah.
You know what I mean? So I
Yeah.
think people are more cognizant of it,
Yeah.
and they're like, we want to look our best.
Yeah.
You know, and video, people are doing more video now.
Yes.
I feel like everything's going to video now, and I think this is another reason why it's so popular is people want to not only feel great, but they want to look great.
Yeah.
So
Absolutely.
All right, Nicole, where do you see the aesthetic industry heading in the next 3 to 5 years?
This industry is ever evolving. We are in right now and moving more towards regenerative type medicine. Like I said, regenerating collagen and elastin. I feel like collagen is such a buzzword, but it really is what gives us plumpness and thickness in our skin, which is so important. And not anti-aging, but just softening aging. So I think that things like Sculptra, Radius, microneedling, lasers, things are only going to improve in those sorts of industries.
absolutely, because I remember in high school, I used to play at the racket club in Lynn Haven, and it was some of my fondest memories because I would play with elderly ladies. They were in their 70s, and we would play doubles, and it really helped my net game. But the majority of them all had facelifts, and they were the dearest friends and so nice, but it was a little like, oh my gosh, like it wasn't natural.
Right.
It was but I just feel like we've just in 20 years,
Oh, absolutely.
we have just improved, I guess, in this space.
Yes. So, and that's mainly because like we have found out that like fillers and treatments, things like that are lasting much longer in our bodies than originally anticipated. Filler, just for an example, the recommendation when I worked in dermatology was come back every 6 months for your lip filler. A whole syringe of lip filler cannot be absorbed by the body in that amount of time. And so then you're getting overfilled and it looks very overdone. And so I think a lot of people still have that outlook on filler. They're like afraid of it because of that
Oh,
recommendation.
I'm one of them.
Now, I mean, everything can look so natural. And I mean, I get asked all the time, like, how long is this going to last? I'm like, it's very different. I have patients who 2 years later, their filler, like, and their lips looks like amazing. They're super happy. I have people coming back like every year. It just, it varies from person to person.
Absolutely. What is one trend that you're seeing that's kind of overhyped or concerning that you're seeing kind of in this business?
At home treatments.
Oh no.
Yeah.
Can you imagine?
I've heard people
What?
doing that.
Wait,
It's scary.
explain this. People are
So the most common I feel like right now is people ordering like microneedling pens and stuff like that, which I mean that's not super dangerous, but it can still like tear your skin. And I tell patients all the time, I'm a nurse practitioner. I am not a salesperson. I am here to give you guidance on what I can offer you that I think will best like fit your needs and your desires. But I'm not here to sell you. And so, but there is very much like a difference in medical grade versus like something that you can find on Amazon or whatever websites there are. So like just microneedling tools, for example, are very much like hot right now for at-home treatments. Wow. And so I tell women, I'm like, you can try it, but it could tear your skin and introduce bacteria into your skin and leave scarring. And also like you're not educated on like what depths to go at. But also I've had patients come in and they're like, yeah, I usually do my own filler at home. And I'm just like floored by that.
Botox.
And Botox. And that's really scary.
How are they getting these products? I know you mentioned Amazon for the microneedling, but
There's all sorts of websites out there. I mean, I even get inundated with messages from different companies offering cheap product. And while that's very enticing, you just can't do that.
because if you go with a cheap product, yeah, you might have more of a profit, but you're not going to see the results that you
Well,
expect.
not just that, but you really don't know what you're getting. And so if it's not coming straight from the manufacturer, you don't know what's in that bottle or in that vial. And so I've had, women and men also come to me like, am I going to get botulism? I'm like, not from my product. because that is a concern, and there are stories from that out there, but those are like any stories out there for anybody who's gotten like botulism before from Botox. Either they got it themselves online and did it, or their injector did, just for a
Wow.
cheaper product.
Why are women or men, why are they, is it because they think they can save money? Is that, is it a money thing?
Oh, I mean, maybe not
Or
always, but
they wanna be in
I think
control?
so.
Do you offer like payment plans or anything like that? Or
Yes, we
that's
accept Cherry and Care Credit, so those are
Okay.
two payment options.
So there you go. Let's go to the professional, ladies and
Yeah.
gentlemen.
Yeah.
Get that payment plan if
Get
you
that
can.
payment
safe
plan.
way.
Yeah, let's do
Yeah.
the safe way, because I mean, you made a good point. This could leave scarring. So
Yeah.
you know what you do is very serious. You are trained. You're a nurse practitioner. You have all the training. You've gone to school for this, and to just like, it would be like me trying to, I don't know anything about
Well,
this
and
space.
self-injecting. What if you
Self-injecting
hit something?
is so scary. I mean,
Yeah.
especially with filler.
Wow.
Filler can cause a lot of issues with blocking arteries and things like that. So if you don't know what depth to go at and things like that, I mean, you can have some serious problems.
Yeah.
Wow,
Yeah.
good to know.
Yeah.
What's one mistake you see people making before coming in, and how can they avoid it?
I don't really see a whole lot of women making mistakes. I mean, if they come in for filler or whatever it may be and have like a couple of drinks the night before, that's never good. You're just at more risk for bruising. But
Oh, that's good to
mostly
know.
like
Yeah, that is-
I have
yeah.
I have some patients who are like, I put on a full face of makeup for you. I'm like, I don't know why you did that. I'm just
you
gonna
want
have
them
to
to no
clean it
makeup,
out.
right?
Yeah.
Okay, so you're gonna see me with my red face. So my
I
worst.
go in there without makeup on.
Okay, she's gonna see my red face.
I mean, it's not a
okay.
big deal if you're like coming from work. Like,
Yeah.
I
Yeah.
obviously have things to take it off, but I'm like, you did not need to put makeup on just for me. I promise.
Or just sit in the lobby.
I know.
We've been fixing up that house that we were talking about on previous episodes, and I was cleaning, and I didn't put any makeup on. I felt weird.
Yeah.
And Tom was like, "What do you need makeup for? You're cleaning a house." I was like, "Good point."
The older I
And nobody
get, the
would see
less
me.
I care. Yeah.
I know.
Yeah.
I think so. You're just like, whatever. Like,
Yeah.
nobody notices. That's the thing. Like,
Yeah.
if they'll be like, "Oh, you look the same."
Yeah.
Yeah, I know. Exactly. I don't know. I wear makeup during the week for work, but that's pretty much it.
Heather and I talk a lot about balance a lot, and we're still trying to figure it all out. But
hard.
how do you balance? I mean, you are the owner operator of this company. You built it from the ground up. You do a lot of social media marketing. You have a family. How do you balance it all? And what advice you could give to young professionals?
I had to learn to set boundaries. You know, it's hard to turn away business, and so you know, first opening, I was like, do I need to be open from like 8 a.m. to 8 p.m.? Like, what do I need to do to get people in? But I quickly learned that that's really not healthy. I've got a young daughter at home. I really want to be present for her. So as soon as I was able to afford to hire like a social media manager, I quickly did that. Yes, that's
Smart.
less profit on my end, but it's so worth it because I was going home, creating reels and like editing things and not being present. And so I really had to learn to set some boundaries, hire some help, and then just maintain a little bit of balance. It's still really hard.
Yeah.
I feel like I'm working like 24/7. Just, you know, Fridays I'm closed, but I was sitting there FaceTiming a patient after I did some treatments on her the day before. But yeah, setting boundaries is definitely the key.
Yeah, absolutely. I think, because, we essentially own our own business too. Like, you're
Yes.
working 7 days a week.
Yeah.
I remember we had the girls at Zoo World, and you were getting calls and stuff,
Yeah.
and just like, okay, like you wanna be present, and I get the mom guilt all the time.
All the time, yeah.
That's good to have. You have a supportive husband, and
Yeah.
that can kind of fill in, and then when he's got to make a phone call, then you go right back
Right.
in, and it's
Yes.
a balancing act.
Yeah.
But I think it's great that you're setting boundaries and kind of focusing on, okay, this is really important, and I want to teach my daughter that hard work pays off.
Yes.
But at the same time, we are going to celebrate these awesome moments together. We're going to go on
Yeah.
trips and things like that. So
Yes.
that's good to know.
Definitely.
And I have to remind my husband of that too.
Yeah, I know. Me too.
But
Oh my
when I
gosh.
have another trip planned, he's like, "Oh, we're going already." I'm like, "We have to create these memories.
Yeah,
We'll never
absolutely.
get this time back."
You're never
Absolutely.
going to get them back. Everyone tells us, because our daughters are
The same
same age,
2 weeks
and
apart.
like it goes by so fast. It really does go by so fast.
Oh, I know.
And
My iPhone reminds me of that every day with the pictures and the memories. I'm like, "Thank you so much for the gut punch."
absolutely. And I did see something the other day on social media where it was like, oh, it's hard taking a toddler on vacation. Well, it's also hard having them at home or like there's
Exactly.
the toddler area. I'd rather be where I'm not doing laundry
Yes.
and
Yeah.
dishes and cooking and figuring out what we're doing for dinner for,
Yeah.
a couple days is nice.
Yeah, it is nice.
And
I
to
agree.
like recharge. Is there anything else that we haven't asked you that you want to tell, residents of Bay County, or anything about your business that we didn't cover today? You think?
I don't
Where can
think
people find
so.
you? Where can people find you?
So I'm on Facebook and Instagram. It's Illume, ILLUME Medical Spa. I believe my Instagram is Illume_Med Spa.
Okay.
I can't remember.
And you're right off of Jinx Avenue.
I am off of Jinx.
Great location.
Yes.
Everybody
Yes.
knows where Jinx is at.
Yes.
Anything else, Heather?
No, I think that's it.
Well, thank you so much for joining us.
you.
It was
That was
fun,
fun.
super informative.
Yeah.
We are going to drop all of Nicole's information on this episode so you can find her, give her a call. She's awesome. From the moment you meet her, you will not be disappointed.
I love it. She
Thank
does a good
you.
job. She does my Botox.
She
lip
will be
flip,
doing mine in the near
microneedling.
future.
Yeah, I love it.
So,
Thank
thank
you.
you.
Thank you,
All right.
Nicole.